The principles of the legislation can be stated in three terms, which are justification, optimization, and dose limitation. So justification basically says that the risk must not be, so the benefit must outweigh the risk. So the benefit of using an ionizing radiation must outweigh the risk that that radiation will cause to the staff who are operating the equipment, the patients who might be receiving the dose, as well as the risk to the public, as well as the risk that occurs from things like accidents, etc. The next principle is optimization, which says that the dose to the patient must be as low as reasonably practicable. And the final is dose limitation. So dose limitation says that there's certain doses which must never be exceeded, and dose limits are mostly placed for the public as well as for staff which work with ionizing radiation. So let's quickly move forward and look at which are the important regulations that we're looking at. So the two most crucial regulations are the ionizing radiation regulations, and the latest version was published in, not published, but like came into effect in 2017. So just a quick summary of what is in IRR 2017. So first, all of these come under the Health and Safety Work Act at 1974, which established the Health and Safety Commission and also the Health and Safety Executive. So IRR 2017 is enforced by the Health and Safety Executive. It applies to all work that happens in the workplace with ionizing radiation. Employers have to follow IRR 2017 or they will be held liable under criminal law. And IRR 2017 also says that employers are the ones who bear sole legal responsibility for ensuring that the stipulations of the law followed in the workplace. And IRR 2017 is not applicable to patient dose. The considerations which apply to patient dose come under IRMER 2017 or ionizing radiations medical exposure regulations, which we'll also be discussing in just a second. So I don't have, there's quite a bit that comes under IRR 2017. So I won't be able to touch on all the details as I already mentioned previously in the session, but we'll quickly look at what are the most important things that come under this. So one of the things is that work with ionizing radiation is categorized under a three-tier risk-based system, and the categorization is done based on the risk of exposure. IRR 2017 sets in place certain dose limits which have to be followed, and these apply to the dose which employees are subject to as well as the public. And you can just see them in that table on the left over there. And public dose limits can also apply to, as well as people who don't work in the workplace, they can apply to staff who don't work with ionizing radiations, and also the children, friends, and relatives of comforters and carers. And comforters and carers are people who willingly consent to being exposed to a higher radiation dose in order to tend to their kin or friends who are undergoing radiation treatment. So a few important things that the legislation stipulates is you have to appoint a radiation protection advisor who needs to be qualified according to the requirements of the HSE, and this person's primary responsibility is to ensure that you are carrying out all of the is to ensure that you are meeting the stipulations of the legislation, and also to advise you as you do that. Now, while the RPA or RPAs will overlook this on a higher level, the people who will ensure that these stipulations are being met on a day-to-day basis are called the radiation protection supervisors, and you're required to appoint both these types of people, and they do have to be qualified according to what is given in the law. And you may also appoint a radiation protection committee, which will work together to act as a link between the management, the staff, as well as the regulatory bodies. So preparing reports, presenting them, identifying possible areas of concern, etc. will all happen within the Radiation Protection Committee. Another important thing which IRR 17 says you have to do is carry out risk assessments. So every single activity that you're carrying out with ionizing radiation needs to be assessed for risk, and you need to do this before you start the activity. And basically the RPA will help you identify what are the different risks which will be faced by staff, public, and patients, and you'll help you put in place control measures to minimize risks. What kind of control measures could they possibly put in place? So they'll come to like an apex of things that you can do. At the top of the things you can do is giving PPE to people who need it, or you may also put in systems such as warning signs, closed doors so that somebody doesn't randomly walk into a room where they're in danger of being exposed, etc. So it's the employer's duty to ensure that the RPA goes through every single activity with ionizing radiation, carries out this risk assessment, and then helps put in place a system of control measures to minimize risk. Other controls to reduce exposure, for which there's extensive detail given in the legislation, is the designation of radiation areas. So as we already know, there's two types of areas that you can create, the controlled area and the supervised area. And we also know there's a lot of details which help you identify which is the controlled area and which is the supervised area. So I'm not going to go into those details right now because we wouldn't have enough time, but please do pay attention to those things when you're reviewing this section. Another thing that you are required to do is have written working procedures to minimize exposure. So, and the final thing is what needs to be put in place for day-to-day protection. Yeah. And one of those, another thing which you're required to do under IRR is dose monitoring, and your dosimeters also have to follow certain rules. So those of you who attended the previous sections will know that we also did a little bit of looking at personal dosimeters and the types of dosimeters that there can be, and how the units which are used in dosimeters are slightly different from the ones we looked at, equivalent dose and effective dose, but we will not have time to cover that in this session. So if you want to look at the details of those are there in the previous webinar. So there's also regulations involved for dose monitoring. Personal protective equipment also needs to follow the PPE regulations, which were published which came into effect in 2002, and these just to ensure quality control. It is also the responsibility of the employer to store and maintain the PPE, and it is the responsibility of the employees to use the PPE as it is stipulated in the written working procedures. Another thing which the IRR does touch on is reporting radiation incidents. So what are the types of radiation incidents that you would report? They would include things like overexposure of any person, be it the public or your staff. They could involve radiation contamination, which is where there's a leak or an accident and some source of radiation has been exposed. And they could also, a radiation incident would also be a failure of equipment. That is also something which you're legally required to report. So when it comes to reporting the failure of equipment, there is a guideline multiplying factor which allows you to determine whether a failure of equipment has taken place. And for every procedure, as you can see on the left, there's a different guideline multiplying factor.